Hello, my name is Fernando McLean with the Primary Care Development Corporation. I'm a performance improvement analyst here at the Primary Care Development Corporation. Good afternoon to those that are joining the call on the East Coast, and good morning to those that are joining on the West Coast. So today's webinar is going to be based on the Medicare's Quality Resource and Use Report. So we'll just go right into it. So the objective of today's webinar is to give you a high-level overview of the QRUR, the program through the Centers for Medicaid and Medicare Services. We'll then take a deep dive into the components that actually make up the QRUR. We'll speak to the mechanisms of the MACRA, Medicaid Access Chip Reauthorization Act. And then we'll identify how the merit-based incentive program, which is the MIPS, plays into the QRUR, and then we'll convey how to interpret how the QRUR and the plan your value-based improvement strategies and what are those entities. Again, today's agenda, we're going to give you the overview of the QRUR. We're going to speak to the PQRS. Which is the Physician's Quality Resource System. Then we'll go into the VBP, and then give you an overview of MACRA and provide you with the case studies. So there's a lot of acronyms which I will define as we go along. Yes. So for the high-level overview of the QRUR, we really want you to understand that the QRUR should be understood as a tool, which is an intricate, and speak to all of the intricate components of that and how it plays into the future of healthcare payment. Again. So what is a QRUR? I'm guessing all of you are asking yourselves what actually is a QRUR. The QRUR should be really understood as a tool to be utilized for performance improvement and transition to the new payment models provided through CMS. The Quality Resource Use Report provides feedback and benchmarking tools provided by the CMS as part of the physician feedback program. They offer information about the cost and quality of care provided by physicians or groups to a certain Medicare patient. A crucial component of the QRUR is the actual PQRS, which I've mentioned earlier, which is the Physician Quality Reporting System, and that is actually the first step in actually obtaining your QRUR. So we'll speak a little bit more to the PQRS application going forward. So how do you create? How is the QRUR created? The report is created with two main components, being the PQRS quality measures, claims data, outcome and cost measures, and it provides a benchmark which compares similar size pair groups. When is the QRUR sent to you? So there are two reports that are provided for you. There's the mid-year, which is disseminated in the spring, and then there's the annual, which is disseminated in the fall. The mid-year report is really helpful in that it provides an overview of how you're doing up until the spring, and it allows you to have an idea of where you're lacking and where you can pick up for the annual report, which is actually utilized to calculate the payment adjustments. And throughout the year, you can also request an optional supplemental report upon request. But the two reports that you receive would be your mid-year and your annual. So what is the PQRS? As I mentioned, the Physician Quality Reporting System is the first step in actually obtaining the QRUR. On the PQRS, you're mandated to report on at least 9 measures that covers 3 national quality forum domains for at least 50% of the denominator eligible Medicare fee-for-service patients. The national quality forum, you just have to cover 3 of the 6 domains. The 6 domains include effective clinical care, communication and care coordination, patient safety, efficiency and cost reduction, community and population health, and person and caregiver-centered experience and outcomes. So you just have to cover 3 of those national quality forum domains and report on at least 9 of those, 9 of the measures covering those 3. The PQRS also assessed quality of care physicians provided to the patients, and it also qualifies how often they're meeting a particular metric. So understanding the importance behind the PQRS, simply put, is to just avoid the negative payment adjustments. That's the biggest take home with the PQRS, and what you'll see going forward in today's webinar is you just want to avoid the negative payment adjustments and put your practice in a position where you can reap the benefits of high quality measures. So again, you really would want to avoid the PQRS negative payment adjustments through actually submitting this data. Also, another important factor would be avoiding the automatic downward value modifier payment adjustment and be eligible for upward, neutral, or downward payment adjustments based on performance. Meaning, as long as you submit the data, you would alleviate the option of receiving a downward turn, a downward adjustment. Sorry. And at this point, with all of the background information provided, how to apply for the PQRS. So you can determine your eligibility and choose reporting mechanisms, type of reporting, select and report your measures. Reporting mechanisms can be claims reporting, registry reporting, electronic reporting using the certified electronic health records. And your measures address various aspects of care, such as disease prevention, chronic and acute care management, and procedure related to care. Okay, so this is the website here where you can go on and actually get started with your PQRS. So we'll just take a minute here so you can just review that. Okay, so again, so that was the first step, completing your PQRS. So here's an example of a QRUR annual report, which, as you can see, this practice received a negative 2% adjustment. The QRUR shows how your group or solo practice, as identified by the Medicare Enrolled Tax Identification Number, which is your TIN, performed in calendar year 2015 on the quality and cost measures used to calculate the value-based payment modifier for 2017. So in 2017, the value modifier will apply to all physicians in groups with 2 or more eligible professionals, which will touch on what an actual eligible professional encompasses a little bit later in the webinar, and the physicians who are solo practitioners who bill under the Medicare physician fee schedule. Okay, so for this TIN, they did not meet the PQRS reporting criteria and they received an automatic downward adjustment of negative 2% on the value modifier. So this is another example of the list of reporting that's available on the QRUR. And this is just an example from Table 3A from the annual QRUR. So again, you can utilize your PQRS feedback reporting as a good resource to view how your practice's quality measures are being reported. So it gives you a really good benchmark and an overview of how you're doing as it relates to quality. So here's another example of the QRUR reporting, which is another example of Table 3A. So we can go from left to right, the columns. So the first column, you have your service category. So it pretty much depicts all of the services that the practice performs. And then the other two columns, well, the bucket that the other two columns would go into would be your TIN, and under the TIN, those three columns, the number of attributed beneficiaries using any service in the category, percentage of beneficiaries using any service in this category, and per capita cost for attributed beneficiaries. So under the TIN, it really accounts for all of the services billed under your practice's TIN. Then it speaks to the percentage and then the per capita cost. And then that third bucket there, all TINs and peer group, that is pretty much the benchmark of comparable practices in your area. So that first column would be the benchmark, national mean percentage of beneficiaries using any services in this category. The second would be the benchmark, national mean per capita cost. And then how much higher or lower, so then the difference between how you ranked and as it relates to your peers, the benchmark. So we can see here that we were looking at, for the service category, primary care physicians, and we see that the number of attributed beneficiaries using any service in this category is 249, and the per capita cost was 424. And that would mean, so with that, for 424, we see that the pair group's benchmark was over by $78, which would result in a negative downward turn or leading to a penalty. So on the other side, more for a positive result, we see that the emergency evaluation and management services, the per capita cost for this practice was $106. The industry benchmark was $302. So there was a cost savings of $196, which would result in a positive result, which would be a positive adjustment for this practice. So we just wanted to provide two examples, both a negative and a positive, and how it's depicted on the QRUR and all of the other service categories that's included onto this report, which would be really helpful just to see how you're doing compared to other payer groups in the industry. Okay, so we spoke about the PQRS, what it means to QRUR. We actually reviewed a QRUR annual report. So I just wanted to give you the side-by-side view of the mid-year QRUR and the annual QRUR, just to kind of have an idea of what's included on the QRUR mid-year and what's not included. So we can see here that in the shaded region for the mid-year report, this data is not included, which would include the value modifier calculation, the PQRS quality measure, and the cost composite score for the mid-year. However, in your annual, it provides a complete overview and assessment of your practice's performance. So that's good to know that in your mid-year, it isn't a complete assessment of your practice. However, it does provide you with information on where you can improve. So the importance of utilizing your QRUR, again, it provides a really good benchmark for you and your practice to really understand how you rank amongst your peer groups. It provides your TIN's performance highlights, so you can really understand how each of the physicians under your practice or that's billing to your TIN actually is performing within the network. Provide the quality composite score calculated by PQRS measures. Again, so we see the importance of the PQRS as it relates to QRUR. A cost composite score calculated by the claims data, and it all plays into the value-based payment. So the value-based payment ties provider reimbursement to quality of care based on the triple aim, which we note as being better population health, better individual health, and lower costs. So moving forward, we understand that the QRUR is really to be understood as a tool to help you improve your performance, to help you with performance improvement, as well as transitioning to value-based care. So we'll speak to the value-based payment a bit more in detail going forward in the webinar. So as we provided for PQRS, how to obtain your QRUR, this would be obtained through the CMS website, and this is a screenshot of what it would look like once you go to the website provided in the link above. And all of the information and resources that we've utilized during this webinar would be provided at the end in our resources. So to provide an overview of MACRA and really understand what MACRA is, we want to understand that the Medicare Access and CHIP Authorization Act of 2015, the federal law, is really reshaping the payment models for Medicare and transitioning from volume to value. We understand that. So we understand that it impacts the fee-for-service Medicare Part B payments. It replaces the sustainable growth rate by giving tools, models, and resources to help physicians give their patients better care. Modifies the method. Medicare rewards clinicians for value over volume. Again, so we're moving from we're really trying to prepare ourselves to provide that high quality value through the quality resource use report. So really utilizing the QRUR to understand the quality and where you're ranking amongst your peers. That really helps with moving towards this the new push in MACRA. Again, it provides multiple pathways with various levels of risk and reward for clinicians to incorporate more payments to value. So understanding understanding where you are and how you're performing is essential to moving to value and reaping the benefits of this new payment model. So what is MACRA again? So it streamlines the various quality generated programs under the newly established MIPS, which is the merit-based incentive payment system, which will take a deeper dive into MIPS going forward. But just to really understand how MIPS plays into MACRA. MACRA also provides a financial incentive for eligible advanced alternative payment models, which the advanced alternative payment models minimize additional reporting burdens for participants in APMs. Also supports multi-payer initiatives, i.e. Medicaid, Medicare, and advantages. Yes. So again, the important takeaway from MACRA is that we're shifting from volume to value, and it also provides the multiple pathways through the MIPS and the APMs, which we'll speak to in depth. So as I mentioned earlier, really defining who the eligible clinicians are it puts things into context and understand who this affects. So let's speak to who's included in the eligible clinician recognition. Pretty much all of your clinicians, from your MDs, your DOs, PAs, NPs, and clinical nurse specialists. But what really sets it aside is who bills $30,000 plus a year and care for 100 plus Medicare patients a year. So that's what really classifies under the eligible clinicians. All of those that are billing $30,000 plus a year and or care for 100 plus Medicare patients a year as well. And as you see here, who's excluded, the new Medicare enroll eligible clinicians and clinicians with low patient volume of Medicare revenue, less than 30,000 or less than 100 Medicare patients a year. So the takeaway from your eligible clinicians, just to provide an example, in MACRA and MIPS incentive payments, like meaningful use, it's based on provider-specific data. So it's important to define which clinicians are actually eligible. So this just really gets to the crux of it and understand who's impacted and who's being evaluated when you want to understand your value and the data that's going into the QRUR. So what's MIPS? So to take a deeper dive into what's the merit-based incentive payment system, we really want to drive home that it consists of the PQRS, again, value-based modifier, and Medicaid EHR incentive programs. So MIPS is essentially the overarching program, which takes all of this quality data, and then it provides the composite score, which provides the backing behind how you receive either your upward or your downward adjustments. So the MIPS is broken into 4 components, which is the quality, which is derived from the value modifier, and the PQRS again. So again, we see the importance of the PQRS. Resource use, which is through the EHR, which is through the QRUR and derived from the value modifier and PQRS. The third is clinical practice improvement activities, which comes from the PQRS, and just to highlight, PCMH recognized practices, or practices that are looking to become PCMH recognized, could really utilize like their care coordination, shared decision making, expanding of access to obtain and really leverage this component of the clinical practice improvement activities. And then the 4th component, which would be the meaningful use and certified EHR technology, which we know has been renamed and is now known as the Advancing Care Information. So within each of these 4 components, we'll then assess how they're actually weighed. So I have a visual, which is coming, to really weigh the components of the MIPS categories. So as we can see here, quality is 50% of this weight. What we've mentioned so far with PQRS and QRUR, this is where you really obtain and assess your quality. And going forward, we understand that quality is going to play a huge role in the MIPS composite score. The 3rd highest would be advancing care information. 2nd, clinical practice improvement activities. And then resource use. So why do we care? Practices will receive either an up or down adjustment. This is the focal point of really understanding the MIPS composite score and the performance, is that you will receive either an upward or a downward adjustment through 2019 through 2022 and onward. So again, utilizing the QRUR as a tool can be really beneficial, as it can be leveraged to strengthen and transition to a more advanced risk-bearing program with financial benefits. So transitioning to advanced alternative payment models really is based off of your use of the QRUR in how your practice is performing and how beneficial these alternative payment models could be. So some of the requirements of the advanced payment models would be the use of a certified EHR. The payment is based on comparable quality measures and enhanced medical homes, i.e. PCMH, or more than normal risk bearing if there are downward adjustments. So to really put this into context, it all depends on how your practice is performing on these quality measures and how you're strategizing a service plan to actually accomplish your goals. So as an example, in New York State, the CMS Comprehensive Primary Care Plus, when practices really being comfortable with their quality reports and understanding where they would need to improve would put them in good standing to actually reap the financial benefits of these advanced alternative payment models. Again, so we've reviewed and assessed all of the information from PQRS, QRUR, MACRA, MIPS. Now you're asking yourself, how does it relate? Can we bring it all together and understand the relationship between the QRUR and the MIPS in a simple context? So the MIPS combines the PQRS Medicare EHR incentive payment program and the value modifier into a single program. And QRUR is at the core of each of those programs. Obtaining your QRUR report really puts you in good standing to understand how you're doing and what that means to MIPS. And depending on how you're doing in your QRUR reporting and on your quality measures depends on your adjustment through the MIPS. A point to highlight, PCMH practices can leverage their management of chronic care patients and care coordination activities to improve their quality indicators. Now understanding the relationship between your QRUR and your value-based payment, essentially your value-based payment is based on quality of services and outcomes. And the QRUR provides your quality of services and the outcomes. As we've seen earlier in the webinar, you really get an opportunity to see the benchmark. You get an opportunity to see your per capita costs, and it really depicts how you're performing from the previous calendar year. So based on the value, so as it relates to the value-based payment, the QRUR is at the core of it, and it really gives you an idea of how you're doing and how you can improve your practice. The QRUR is a tool, again, that can inform clinicians of two things: where they are in relation to other providers on spending for services in areas where they have no control of costs that impacts them, i.e. specialty services, and two, information on cost, quality of care, and outcomes measures related to the patient services and care. So to put the theory to practice and really understand what we've learned today, we have a case study which just to run down the profile of the case that we're going to discuss, it's a hospital-based multi-provider practice, participates in the New York State Delivery Service Reimbursement Incentive Payment Program, 7 primary care clinics located in 4 counties in central New York. This data was extracted, this is an extracted QRUR this practice extracted the QRUR for the first time in December 2016. As a result, less than 50% of the eligible physicians reported PQRS data for 2015, with result in a 4% penalty towards billable services on their TIN for the 2017 calendar year. So this practice did not meet all of the clinical measures, so they received a 4% penalty towards their billable services. This is something that we would want all of you to prevent. So going forward, the activities towards improving 2016 results, confirm registration for group registry reporting, identify at least 9 PQRS measures on at least 50% of the group's applicable Medicare Part B fee-for-service patients. So really understanding that PQRS would be that first step. Make the first step in completing and applying for the PQRS, then moving on to your QRUR report. Okay, so a deadline to really highlight, if it's this is the only thing that you can take away, submit the 2016 PQRS data by March 31st, 2017. Again, March 31st, 2017 would be the deadline to submit for 2016 PQRS. And of course, there are potential outcomes, the reduction or removal of penalties for 2017 calendar year. So understanding that the data is over 2 years, so you would really want to get the ball rolling if you have not done so already. So with all of the information obtained today during the webinar, what's the next steps? So as we mentioned, apply for the PQRS so that you can obtain your QRUR. We understand that the first step would be your PQRS, leading to the QRUR. Use the QRUR to review the practice's quality and costs of care against peer groups. So again, utilize the QRUR as a tool to improve your performance improvement and transition from volume to value, and really get a holistic idea of where your practice ranks amongst its peer groups, and understand where you would need to pick up if there are any areas that you may be lacking. Remember, the QRUR is one component of the MIPS. However, it's a very crucial component of it. It's actually at the core, where you really get to understand how your specific practice is doing, and you can improve upon those results. As I mentioned earlier, considering becoming a patient-centered medical home, the PCMH recognition really sets you up to have an upper hand over practices that aren't, in that most of the quality measures are built into this program. So becoming patient PCMH recognized actually allows you to become very familiar with a lot of the quality measures that have been mentioned in today's webinar. And of course, the overall effective, there's a financial impact to not having PQRS and QRUR. So you really want to avoid the negative financial impacts of not having the PQRS and QRUR. So as mentioned, here are all of the resources that was utilized in developing today's presentation. And thank you for your time, and thank you for joining us today. And I can be reached at the number below and the email. Again, my name is Fernando McLean, and at this time I can take any questions And if there aren't any questions, I can be reached at the email or the phone number. Again, if anyone has any questions, you can utilize the chat. And if there are no questions, we will end today's call, and you can send me an email or a call for any additional resources or any of the information that we went over. Thank you.